Hello, welcome everyone to our exciting course on implementation of long-acting drugs for treatment and prevention of HIV. I'm Sue Swindells. I am a professor of infectious diseases at the University of Nebraska Medical Center in Omaha, Nebraska. And it is my pleasure to introduce my friend and co-moderator, Dr. Raphael Landovitz. Raphael, you want to introduce yourself?
Thanks, Sue. Let me add my welcome to everyone. Thanks for joining us today for this really exciting course. I know this is a topic that is really at the top of a lot of our minds as we take care of patients interested in these injectable therapeutics and prevention agents, and really delighted to be here with you all and with my good friend, Sue. I'm a professor of medicine at UCLA in the Division of Infectious Disease here.
So this slide illustrates some of the many contributions of the IAS-USA that are familiar to many of us, and not least of which, of course, is organizing CROI, the Ryan White Care Conferences, and many other things that we are very appreciative of. We do also want to highlight an upcoming series of podcasts, which will start on December 14th. So you can subscribe now to these through your preferred podcast provider. The first one will be Dr. Mike Salg interviewing Tony Fauci. So look forward to listening to that. We have more than 220 attendees registered for this course from many countries listed here. I should add, though, that the focus of this course is going to be on implementation for US sites and US providers, but we do welcome input and questions from our international attendees. So these are the, results of the pre-activity knowledge and practice assessment. So of the, I think, 50-odd people who completed the pre-test questions, the pass rate was pretty low. So we have a lot to learn. We're excited to be able to address some of the same questions during the presentations and panel discussion today. There will be CME available 4.25 hours for physicians and also nurses, pharmacists, and so forth. If you want to apply for CME credit following this presentation. This slide lists the sponsors to whom we are appreciative of their support, and financial relationships with any entities will be acknowledged on the by any of the presenters as we go along. For Q&A, when you want to ask questions, please don't put these in the chat. Put them into the Q&A function, and we will get to as many questions as we possibly can during the Q&A sessions. And so we now go to our opening poll question, which relates to the barriers that you perceive to implementing long-acting drugs. Now, these questions relate to prevention in your practice. We will have a similar question for treatment. So when you think about using long-acting drugs for HIV prevention, what do you see as the main barriers to implementation? Is it cost and reimbursement, lack of training and experience for yourself and your staff, patient preferences and their concerns, logistics and infrastructure of actually delivering the medicine, adherence, monitoring and follow-up, concerns about potential development of drug resistance, or something else? So please vote in this opening poll. Okay. So cost is front and center in terms of potential barrier to implementation for prevention. Lack of training is some, but you could see the results. Okay. The second poll question has the same list of potential answers, but in this case, think about treatment. So when you're thinking about patients that you'd like to provide long-acting therapy for treatment, what are the main barriers that you could think about here? Again, is it cost? Is it lack of training and expertise, patient preferences, the logistics of the drug delivery, adherence, monitoring, and follow-up, potential concerns about resistance, or something else? Okay, so here we have the majority respondents concerned about logistics and infrastructure. Cost is still a consideration for about half of the respondents, but just how to deliver this is a big issue. And also about a third concerned about patient adherence, how to monitor them, and ensure follow-up. So then if we go to two more quick poll questions. First one again about prevention. These are drugs, long-acting drugs for HIV prevention. How confident are you in prescribing and managing long-acting drugs for HIV prevention? So this is a single choice. You get to pick one. You're either very confident, somewhat, or not. Okay, so yes, we have about 20% very confident, but a lot either confident or somewhat, and about 15% not. So we hope that those data will change by the end of today and your confidence will grow. And then confidence in prescribing for treatment. So prescribing and managing long-acting drugs for HIV treatment, are you very confident, somewhat, or not? Okay, so we're a bit of a spread here, more or less a third, and then about 16% not confident. So just a note here that the final PowerPoint presentations and cases will be available after the course. And there is a modular e-syllabus book that has the preliminary presentations, but not the cases.